Hello everyone. In this video we shall study about common peroneal nerve which lies posteriorly and further gets divided into superficial and deep peroneal nerve. It also has some clinical importance which we would see later in this video. The sciatic nerve is the main continuation of the sacral plexus. It terminates as the superior angle of the popliteal fossa by dividing into the tibial nerve and the common peroneal nerve. Common peroneal nerve lies same superficial plane as the tibial nerve. It extends from the superior angle to the lateral angle of the fossa along with the medial border of the biceps femoris. Continuing downwards and forwards, it winds around the posterolaterally aspect of the neck of the fibula, passes the peroneus longus and divides into the superficial peroneal nerve and deep So, the branches of common peroneal nerve are cutaneous branches which are responsible for providing sensory innervations to the skin. There are two cutaneous branches, lateral cutaneous nerve which supplies the lateral side of the leg, and the sural communicating nerve which arises in the upper part of the fossa. It runs on the posterolaterally aspect of calf and joins the sural nerve. The next is the articular branches which are distributed to the joints, which are superior lateral genicular nerve, inferior lateral genicular nerve and recurrent genicular nerve. Muscular branches do not arise from this nerve.
Peroneal nerve is the nerve of the anterior compartment of the leg and dorsum of the foot. It is derived from common peroneal nerve. Its root value is ventral primary rami of L4, L5, S1 and S2 segments of the spinal cord. The deep peroneal nerve begins at the bifurcation of common peroneal nerve between the fibula. The deep peroneal nerve arises in a supralateral aspect of the leg between the peroneus longus muscle and the neck of the fibula. The nerve moves from the lateral compartment to the anterior compartment of the leg. It then follows the course of the anterior tibial artery. Together, these both structures pass between the tibialis anterior and extensor digitorum longus in the superior portion of the leg. The deep peroneal nerve crosses the ankle joint, passing anterior to the extensor retinaculum. It terminates into two branches, lateral branch and medial branch. The lateral branch turns laterally and ends in the pseudoganglion deep to the extensor digitorum brevis. The medial terminal branches ends by supplying the skin adjoining the first interdigital cleft and the proximal joints of the big toe. Muscular branches supplies four muscles of the anterior compartment of the leg: tibialis anterior, extensor digitorum longus, extensor hallucis longus and peroneus tertius. The extensor digitorum brevis on the dorsum of the foot. A cutaneous branch supplies adjacent sides of the first and second toes. Articular branches supplies the ankle joint, the tarsal joints, the tarsometatarsal joints and the metatarsophalangeal joints of the big toe.
Superficial peroneal nerve. It is the main nerve of the lateral compartment. Origin. It is the branch of common peroneal nerve. Root value is ventral primary rami of L5 and S1. Course. The nerve begins on the lateral side of the neck of the fibula through the peroneal muscles, becomes superficial at the junction of the upper 2/3 and the lower 1/3 of the leg. In the distal part of the leg, it becomes cutaneous and supplies distal part of the leg and dorsum of the foot. The nerve innervates under cover of the upper fibers of the peroneus longus, upper 1/3 of the leg. It descends through the substance of peroneus longus, middle 1/3. It descends for the short distance between peroneus longus and brevis. Descends in the groove between peroneus brevis and extensor digitorum longus. At upper 2/3 and lower 1/3 of the leg, pierces deep fascia to become superficial. Divides into medial and lateral cutaneous branches which descends into the foot.
Superficial peroneal nerve and its branches. muscular branches, peroneus longus and the peroneus brevis. Cutaneous branches. Through its terminal branches, the superficial peroneal nerve supplies the lower one-third of the lateral side of the leg and the greater part of the dorsum of the foot, except for the territories supplied by the saphenous, sural, deperoneal and plantar nerve. Medial branches. It crosses the ankle and divides it into two dorsal digital nerves, one for the middle side of the big toe and the other for the adjoining side of the second and third toes. The lateral branch is also divided into two dorsal digital nerves for the adjoining side of the third and fourth and fifth toes. Communicating branches. The middle branches communicates with the saphenous and the peroneal nerves and the lateral branch with the sural nerve.
Clinical anatomy: foot drop. The peroneal nerve injury. The patient is unable to raise the front part of the foot due to the weakness or paralysis of tibialis anterior muscle, which lifts the foot up. So, when the patient is walking, a common symptom of foot drop is high steppage gait, often characterized by raising the thigh up in an exaggerated fashion while walking. When the person with foot drop walks, the foot slides down onto the floor. Foot drop usually results from injury to the peroneal nerve, which is susceptible to injury at any point of its course. Sciatic nerve starts in lower back and runs through the buttock and lower limb. In lower thigh, just above the back of knee, the sciatic nerve divides into two nerves, tibial nerve and common peroneal nerve, which innervates different parts of lower leg. Common peroneal nerve then travels anterior around the fibular neck, dividing into superficial and deep peroneal nerve. Deep peroneal nerve give innervation to tibialis anterior muscle of lower leg, which is responsible for dorsiflexion of ankle. Condition causing foot drop. First, L4, L5 disc herniation. Second, sciatic nerve injury. Third, lumbosacral plexus injury. And fourth, injury to. This is the patient of foot drop. You can see the patient's left foot is dropped. Patient is unable to dorsiflex the foot. This is